This is the Health Buddy. And this little box goes into somebody's home. It is plugged into their phone line. The consumer or the client would go push the button, and it says, "Welcome to Health Buddy," and it's personalized. So if your name is Mary, say, "Welcome," or "Hello, Mary, good to talk to you today," and it would go through a scheme of questions each day on their particular diagnosis that they have. A lot of my consumers or clients would say it really was their buddy, and they liked it because it was someone to talk to, even though it wasn't a person, you know. And sometimes they don't, even though they knew I was somewhere on the other end, it felt like they were just could open up and say, "Oh, this is what's happening today," and they like that. And there has been a lot of different positives, whether it's we could say, "Okay, what's going on," and kind of intervene sooner if there was an issue coming up. I've also seen it work great. We had a client that had called emergency services quite often. He started the Health Buddy, and that totally declined the calls. It was very interesting to see how much just having the Health Buddy in his home helped to decrease his calls elsewhere.
My name is Michael Belial. I've been diagnosed with bipolar, depression, anxiety, suicidal tendency, and PTSD. No, very simple. A lady came to my house and brought the unit over and explained as far as how the installation would go, that she would contact, Fairpoint. They would come over, and because I didn't have a landline, they would come over and install the landline, and they would pay for the landline to be installed and the monthly payments and stuff. And it took her a matter of minutes. It was very simple installation, very simple explanation on how to use the unit. Very, very simple.
My name is Iris Pepin, and I'm a manic, anxiety, and post-traumatic stress disorder. I got up and actually woke up a little bit more. And then I went and answered the questions that were on my Healthy Buddy for that day. And then you answer some medical questions, and at the end there's usually the trivia questions. It makes you realize if your meds are working with some of their questions, and sometimes you really don't notice it. You're just like, "Oh, well, I'm just feeling it this day," and everybody has bad days, so I must be having a bad day. And if you answer that same question like 2 or 3 days in a row, you're realizing, "Oh, this isn't a bad day, this is something else."
My name is SERENA Newton. I am 39 years old. If I having a bad day, I always do my Health Buddy, and sometimes it will tell me to do something. Like if I'm depressed, it will say, "Okay, you're depressed, dance in the living room." So I dance in the living room, and it makes my day. And if I have like a bad day, I just put down, "I'm having a bad day," just pushing the buttons. It will say, "Call the nurse," or "Call the doctor soon as possible." So I won't end up in the hospital.
My name's Catherine Manias. I'm 32. I've had mental illness for at least 15 years. Well, one of the nurses, I guess, referred me to the Health Buddy, and I said, "Why not? It's worth a try. I would see if it works." It does work, but I think it needs to work more. I think you need to have it in the morning, in the afternoon, and at night. Because I found myself doing the health buddy like 10, 11 o'clock in the morning, and then I would want to do it again. But I couldn't because you can only do it once a day.
My name is Kate Marcial. I'm 29, and I have anxiety disorder, more specifically PTSD. When I get particularly stressed out, or my tendency is to isolate. And one of the regular questions it would ask is, "Are you socializing?" Which, you know, if I get into a deep isolation, it can be so hard to break out of that. So that would kind of remind me, you know, I might say sometimes, you know, and it would say, just call a friend. You know, it doesn't have to be in person. Call a friend, and that can help.
Darlene Kellison, I'm 60 years old, and I found there were times, there were questions the health buddy would ask that I would answer with, I wasn't necessarily more honest, I was more direct and didn't couch it as much. When I deal with a person, I'm watching their reaction and I'm modulating my response based on their reaction. If somebody starts to look alarmed, I downplay things. You don't do that with a machine. I don't even know that if I saw a therapist every day, that it would produce the same thing that the health buddy did because of the way the questions are engineered.
I think it's a kind of a less intrusive way of seeing how people are doing, and they feel comfortable talking to this machine, and yet they do know that there's somebody on the other end of the line. They feel comfortable too, you know, to give me a call.
My name's Arthur Shaver. I'm 32. My illness is schizoaffective disorder, PTSD. If I trained, I thought it was different. The health buddy had different statements that would influence me to pursue it, to try to find that health buddy when it's not to literally find it, but, you know, find it where it's located and use it. And after I did that, I used it. I found it was great. It was helpful. The questions, the things that could be distending, like saying, you know, is this my cup of tea today? And it really gave me a great warmth in the heart to know that I was in a position where I was upset, and then I find a position where I'm finished. And it's like I use the health buddy for that.
So by having the health buddy in their home and having that reason to get up to do it, and have it encourage them to make plans and take their meds and so forth, it truly empowers them to take an interest in their mental health care.
My name is Tracy Craig, and I am 53 years old. I'm a borderline personality, which I'm very up and down with my emotions, and sometimes they get rather hard to deal with. I have some serious things that can happen if I'm not, if it's not picked up on right away. And this allowed it, that health buddy allowed it, that I might start to feel that way, but I could go and use the health buddy, and somebody would call me back and we'd talk. And I'd come down from maybe an 8 to a 3, which 3 is manageable. And which means I didn't have to bother my clinician. I didn't have to bother my psychiatrist. I didn't have to take a spot at Concord Hospital emergency room. It helped in so many ways personally, but it also helped funding-wise, too, and money-wise. I mean, because we're talking the grand scheme of you go to Concord Hospital emergency room, and you're talking a good chunk of change. That health buddy is just a little old machine with buttons on it, but it's far more than that.
Yes, yes. I would like to see the Health Buddy continue.